I'm definitely the oldest guy here, so I'm perhaps the best qualified to speak about how our healthcare non-system, and I repeat, non-system, became so dysfunctional. I am a physician and have been on and am continuing on the faculty and staff of the Johns Hopkins School of Medicine Hospital. I'm now in my 49th year there. In addition, I represent Physicians for Social Responsibility, the Chesapeake or Baltimore chapter, and I'm a member and a supporter of a national program of Physicians for a National Health Program. Our current problems have their roots in World War II, and this very well illustrates the law of unintended consequences. During World War II, to fight shortages in everything, to combat profiteering, to prevent inflation, the whole economy was tightly controlled. There were wage controls, and butter, and sugar, and everything else. Gasoline, tires, meat were rationed and controlled. There were victory gardens. People canned and shared their surpluses, etc., etc. With the severe labor shortages, women were recruited into the labor force. Think Rosie the Riveter. With wage controls, the defense industries and industry in general were prevented from competing for labor by increasing wages. So they used a glaring loophole in these wage controls by offering expanded benefits, including health care benefits. And this is how healthcare in this country, in contrast to all of the other industrialized countries in the world, healthcare became linked to employment, which has been the case ever since. To solve one problem, another was created. The definition of the law of unintended consequences. In 1948, during the rest of the Truman administration, attempts were made to complete President Roosevelt's unfinished agenda, namely to provide everyone in the U.S. from cradle to grave with access to health care. I remember as a senior in high school, the national debate topic was, be it resolved, the U.S. should have a national program of universal health care. This was during the Truman administration. This effort failed because labor and the unions were very happy with their own access to health care through their employment. The American Medical Association was very happy to extend its opposition on the grounds of protecting doctors as small business owners from government intrusion. Meanwhile, European countries were recovering from the devastation of World War II, and they recognized the importance of providing health care to all of their citizens. Fast forward to the current era. The U.S. is the only one of 3 countries in the industrialized world that does not provide health care for all. Want to know who the other 2 countries are besides the United States? Turkey and Mexico. Turkey and Mexico. As a result of the history of this path taken after 1948, we have the most expensive system in the world, non-system in the world, paying twice what other systems in the rest of the world do for their health care. What do we get for this expenditure? More poor health care outcomes than any other industrialized country in the world. More than 49 million people with no health care coverage at all. Up to twice that number with inadequate coverage. Terrible anxiety and frustration and fear about access to health care. People frozen in careers and jobs for fear of losing coverage. The first or second leading cause of individual bankruptcies. Loss of competitive advantages for our major industries who have to compete with foreign workers who have national health care coverage. Suffering and death. How can this system be sustained in the face of these facts? Manipulation, fear, greed, propaganda. These forces are applied by those invested in the perpetuation of the current dysfunctional system. The same forces that were arrayed against our best interests and that took us into Iraq. Same forces. What can we do about it? Tell the truth. Speak up. Organize. Support John Conyers' HR 676. Don't be misled or distracted by incremental changes into believing that the problem has been or will be solved by piecemeal changes. Save money, cover everyone, cradle to grave, everyone in and no one out, Support HR 676, single payer, Medicare-like system forever. Thank you.
Thank you, Doctor.